The call came through at 2:47 a.m. on a Wednesday, the dead hour when exhaustion and adrenaline war for control of your body. Rescue 4, we have a 2-vehicle MVA on County Road 58, approximately 3 miles north of the interstate junction. Reports of entrapment and serious injuries. Fire and police en route. ETA, your location? I grabbed my jacket, my hands already shaking. 4 minutes, I called back, trying to sound more confident than I felt. Dr. A. Catherine Morrison, the attending physician supervising my overnight ER shift, looked up from her chart. Reyes, you're riding with them. Consider this your baptism by fire. It was my second week of residency at Hospital St. Halstead. 2 weeks, 14 days of checking vitals, reviewing labs, assisting with minor procedures under constant supervision, and now I was being sent to an active crash site. I'm ready, I said, though my voice betrayed me. No, you're not, Morrison replied flatly. Nobody's ever ready, but you'll learn fast or you'll freeze. Try not to freeze. The ambulance screamed through empty streets, lights painting the darkness red and blue. I sat in the passenger seat reviewing everything I'd learned about trauma care, but the textbook knowledge felt flimsy, abstract, useless against the reality racing toward us. We arrived to find chaos painted in headlight beams. 2 vehicles, a pickup truck accordion folded against a tree, and a sedan spun sideways across both lanes, its driver's side crumpled inward. Glass covered the asphalt like scattered diamonds. The smell of gasoline hung thick in the cold air, mixing with something else, the copper tang of blood and the acrid scent of deployed airbags. Firefighters were already working on the sedan with hydraulic tools, the screech of metal cutting through the night. I grabbed the medical kit and ran toward the wreckage, my training screaming protocols at me: scene safety, triage, ABCs, airway, breathing, circulation. Through the shattered windshield, I could see 2 people. The driver, a man in his 40s, conscious, trapped by the steering column crushed against his chest. And beside him, a teenage boy slumped forward, held by his seatbelt, blood covering his face. The man turned his head toward me. Even in the darkness, even with blood streaming down his face, his eyes were sharp, focused, analytical. "Are you the doctor?" he called out, his voice strained but controlled. "I'm Dr. Reyes. I'm a resident." "That boy is my son. He's not responding. You need to assess him immediately." I tried to climb through the passenger window where the glass had been blown out, but my hands were shaking so badly I could barely grip the doorframe. The boy, maybe 16, 17, wasn't moving. Blood matted his dark hair. His chest rose and fell irregularly, each breath sounding wet and labored. "His name is Marcus," the man said. "Marcus Chen. He's 17 years old. Check his pupils. Check them now." I fumbled for my pen light, dropped it, picked it up with fingers that felt numb and disconnected from my body. When I finally managed to shine it in Marcus's eyes, my stomach dropped. One pupil was fixed and dilated, the other constricted to a pinpoint. Unequal pupils, brain injury, possible herniation. This was bad. This was catastrophically bad. My mind went blank. All the training, all the procedures, everything I'd studied for years. It scattered like the glass on the pavement. I stood there, frozen, staring at this dying teenager, knowing I should do something but unable to remember what. My heart hammered against my ribs. My mouth went dry. The sounds around me, the hydraulic tools, the radio chatter, the distant sirens, all faded into a high-pitched whine. "Hey!" The father's voice cut through my panic like a knife. "Doctor, look at me!" I forced myself to turn away from Marcus and look at his father. Dr. James Chen, I would later learn. Blood ran from a gash on his forehead, dripping onto his torn shirt. His breathing was labored, shallow, probably broken ribs. The steering column had him pinned, and I could see the unnatural angle of his left arm, the bone pressing against skin, but his eyes were steady, impossibly, incredibly steady. "You're panicking," he said. "Not an accusation, just a fact stated with clinical precision. That's normal. But we don't have time for it. My son is herniating. If we don't act in the next few minutes, he'll die. Do you understand?" I nodded mutely, my throat too tight to speak. "I'm going to walk you through this. I'm a trauma surgeon at Metropolitan Hospital downtown. I can't move, my son is dying, and you're the only doctor here." His voice remained calm, professional, the voice of someone used to making life or death decisions in moments of chaos. "So I'm going to help you save my son. But you need to listen to me carefully and do exactly what I say. Can you do that?" I stared at him. At this father trapped in a wrecked car, injured himself, asking if I could follow his instructions to save his own child. The absurdity of it cut through my panic just enough for a single word to emerge. "Yes," I whispered. "Yes, I can do that." "Good, then let's begin. We don't have much time, but we have enough if we're smart about this." What happened in the next 30 minutes would become the most important lesson of my medical career, taught not in a classroom or hospital, but in the wreckage of a car on a dark highway, by a father who refused to let his son die, even if it meant performing medicine through someone else's hands. Setup. My name is Dr. Sao, Noah Reyes, and before that night, I thought I understood what it meant to be a doctor. I'd spent 4 years in medical school at a good university, passed my boards on the first try, matched into a competitive residency program at St. Halstead Hospital. I'd studied until my eyes burned and my brain felt like it would overflow, memorized drug dosages and surgical procedures until I could recite them in my sleep, practiced on simulation mannequins that bled fake blood and had programmable vital signs. But nothing had prepared me for the reality of emergency medicine. I'd grown up in Houston, Texas, the son of immigrants who'd sacrificed everything to give me opportunities they never had. My father worked construction, coming home each night with hands calloused and back aching. My mother cleaned houses, her knees perpetually sore from scrubbing other people's floors. They'd pushed me toward education, toward a better life, toward medicine. "Mijo," my mother would say, "you're going to help people. You're going to save lives. That's something we could never do." I'd carried that dream through college, through the brutal years of medical school, through the grueling interview process for residency. And when I matched at St. Halstead, a respected teaching hospital with a strong emergency medicine program, I'd felt like I'd finally arrived. Then reality hit. The shift had started normally enough. I'd reported to the ER at 11 p.m. for the overnight rotation, the shift where residents learn by doing because the hospital is quieter, the attendings are stretched thin, and you either sink or swim. Dr. Morrison was the attending on duty, a woman in her early 50s with steel gray hair pulled back in a severe bun and a reputation for being brilliant but terrifying. "Reyes," she'd said when I arrived, looking up from a patient chart with sharp eyes that seemed to catalog every weakness. "Overnight is when you learn what you're really made of. During the day, there are 10 people you can hide behind. At night, it's just you and me and whatever walks through those doors. Think you can handle it?" "Yes, ma'am. We'll see." The first few hours had been manageable. A construction worker with a nail through his hand, painful but straightforward, requiring local anesthesia, careful extraction, tetanus shot, and antibiotics. A college student with alcohol poisoning who needed IV fluids, anti-nausea medication, and observation until he sobered up enough to go home with friends. An elderly woman with chest pain that initially looked like a heart attack, but turned out to be severe acid reflux after we ran an EKG and cardiac enzymes. Standard ER fare. Nothing I couldn't handle with Morrison's supervision. I was starting to feel competent, almost confident. I was thinking that maybe I could handle this after all, that maybe I belonged here, that maybe I'd finally prove to my parents that their sacrifices hadn't been in vain. Then the call came at 2:47 a.m. Motor vehicle accident, serious injuries, entrapment, all available units responding. "Reyes, you're going," Morrison had said, her tone leaving no room for discussion. "Marcus will ride with you. He's one of our best paramedics. Follow his lead, stay calm, and remember your training. And Reyes, don't freeze. I've seen plenty of residents freeze their first time at a crash site. The good ones snap out of it. The others, well, they usually don't last long in emergency medicine." Marcus Rodriguez, the paramedic, not the patient, though the name coincidence would later feel eerily significant, was a stocky man in his 30s with calm eyes, quick hands, and an easy confidence that came from 12 years of doing this job. He'd seen everything, survived everything, and seemed utterly unflappable. "First crash site?" he asked as we climbed into the ambulance, his voice neutral, non-judgmental. "Yes. Advice: it's going to be worse than you expect. The sounds, the smells, the visual of what high-speed impacts do to human bodies, none of that really comes across in textbooks or simulations. Your brain will want to shut down to protect you from processing something that terrible. Don't let it. You need to stay present, stay focused. How do I stop it? You focus on one thing at a time. One patient, one assessment, one intervention. You make the world small enough to manage. Don't think about the big picture, saving lives, preventing death, all that dramatic stuff. Just think, what's the next thing I need to do? Then do that thing. Then think about the next thing, The drive took 4 minutes that felt like 40. I used the time to mentally review trauma protocols, but the information felt slippery, like trying to hold water in my hands. Primary survey: airway, breathing, circulation, disability, exposure. Secondary survey: head-to-toe examination, ATLS guidelines. The golden hour: massive transfusion protocols. All of it felt abstract, academic, useless. We arrived to find County Road 58 lit up like a disaster movie set. Fire trucks with spotlights illuminating the scene in harsh white light. Police cars with lights strobing red and blue. An ambulance already on scene, probably the first responders. Emergency personnel moving with urgent purpose. And in the center of it all, 2 vehicles destroyed, their metal bodies twisted into shapes that shouldn't exist, that couldn't exist, that human engineering had never intended. The pickup truck was wrapped around a tree, its front end completely collapsed. The sedan had spun sideways across both lanes after impact, the driver's side door crushed inward by something. The tree, the other vehicle, physics and velocity, and the cruel mathematics of collision. Glass covered the asphalt like scattered diamonds, catching the emergency lights and throwing back fractured rainbows. The smell hit me as soon as I opened the ambulance door. Gasoline, acrid and dangerous, mixing with the copper tang of blood and something else, something organic and wrong that I couldn't identify, but that made my stomach turn. Marcus, the paramedic, grabbed equipment and headed for the pickup truck. "I'll take the truck driver. He's critical but conscious. You assess the sedan. 2 victims in there, both trapped. Call out if you need backup." I approached the sedan on shaking legs, my medical bag feeling impossibly heavy in my hand. The damage was severe, driver's side crushed by impact, creating a cage of twisted metal around whoever was inside. Passenger side where a tree branch had punched through the windshield, stopping inches from where someone's head had been. Safety glass everywhere, some pieces as large as my hand, others ground to powder. 2 people inside, both trapped, both bleeding, both depending on me. The firefighters were working to cut open the driver's door with hydraulic tools, the jaws of life screaming as they tore through metal. One of them, a young guy, maybe late 20s, turned to me when he saw my approach. "We've got 2 victims, both conscious but injured. The driver's been talking, pretty coherent considering. The passenger, the kid, he's not looking good, not responsive, labored breathing. You're going to want to assess him first." I peered through the shattered window. The driver was a man who looked to be in his mid-40s, Asian, well-built, wearing what had been an expensive button-down shirt now soaked with blood. The steering column had compressed into his chest on impact, pinning him against the seat. His left arm hung at a wrong angle, definitely broken, probably compound fracture given the swelling. But it was the passenger who made my heart stop and my training scatter like leaves in wind. A teenage boy, probably 17 or 18, slumped forward against his seatbelt. The belt had likely saved his life by keeping him from being ejected, but it also meant he'd taken the full deceleration force. Blood covered his face from a deep laceration across his forehead, the kind of wound that comes from hitting the dashboard or windshield. His breathing was irregular, gurgling with each breath. Possible airway compromise, possible blood in the airway, possible everything bad. "Are you the doctor?" the driver called out, his voice cutting through my spiraling thoughts. I tried to answer, tried to sound professional and competent and like someone who belonged here, but my voice came out thin, uncertain. "I'm Dr. Reyes. I'm a resident from St. Halsted. That boy is my son. He's not responding. You need to assess him immediately." Something in his voice, the controlled urgency, the clinical precision even while trapped and bleeding, made me move faster. I tried to climb through the window space where glass had been blown out, cutting my hands on remaining shards, barely noticing the pain as blood welled from small cuts on my palms. Up close, Marcus Chen looked even worse. His face was pale beneath the blood, the kind of pale that speaks of shock and blood loss. His lips had a bluish tint, cyanosis, not enough oxygen. And when I finally got my pen light working with hands that shook so badly I could barely press the button, when I shined it in his eyes, I saw what I'd been dreading. The left pupil blown wide, fixed and dilated. The right constricted to a pinpoint. Unequal pupils. Every medical student learns what this means. It's one of those findings that appears in red text in textbooks that professors emphasize with grave voices. Unequal pupils in a trauma patient means intracranial pressure, means bleeding in the brain, means herniation is imminent, means that every second we delayed, more brain tissue was dying, more function was being lost, more of this boy's future was slipping away. I knew all of this intellectually. I could recite the pathophysiology, I could draw the anatomy, I could list the treatment protocols. But practically, standing there in a destroyed car, looking at a dying teenager, feeling the weight of a father's desperate eyes on me, I froze. My hands wouldn't move. My mind had gone completely blank, as if someone had erased every piece of medical knowledge I'd ever learned. I stared at this dying teenager and couldn't remember a single thing I was supposed to do. Not one procedure, not one medication, not one intervention. The protocols I'd memorized had evaporated. The confidence I'd felt hours earlier revealed itself as the delusion it was. The competence I thought I'd developed showed itself to be nothing more than successful performance in controlled environments where nothing really mattered, where mistakes could be corrected, where death wasn't actually on the table. This was real. This boy was dying, and I was failing. My breathing quickened. My vision started to tunnel. My hands trembled so badly I had to grip the car door frame to steady myself. Somewhere in the distance, I heard voices, the firefighters, the other paramedics, the radio chatter, but it all sounded muffled, distant, like I was underwater. I was having a panic attack, at a crash site, while a patient was dying. "Hey," the father's voice cut through my spiral like a knife through fog. "Doctor, look at me. Look at me right now." I forced myself to turn away from Marcus and look at his father. Dr. James Chen, though I didn't know his name yet. Blood ran from a gash on his forehead, dripping steadily onto his torn and bloody shirt. His breathing was labored, shallow, each breath seeming to cost him, probably broken ribs, possibly punctured lung. The steering column had him pinned so tightly I could see it pressing into his chest with each attempted breath. His left arm hung at a grotesque angle, the bone pressing against skin that was already bruising and swelling. He was badly injured, possibly critically injured. He needed help himself, but his eyes were steady, clear, focused. The eyes of someone who'd been in crisis situations before and knew how to function through them. "You're panicking," he said. Not an accusation, not judgment, just a simple statement of fact delivered with clinical precision. That's normal. First major trauma, worst case scenario, life on the line. Of course you're panicking, but we don't have time for it. My son is herniating. His brain is swelling inside his skull, and if we don't act in the next few minutes, he'll die. Do you understand what I'm telling you? I nodded, still unable to speak, my throat tight with fear and shame. Listen to me very carefully. My name is Dr. James Chen. I'm a trauma surgeon at Metropolitan Hospital downtown. I've been doing this for 20 years. I've handled hundreds of cases worse than this. His voice remained calm, steady, almost hypnotically so. I can't move. I'm trapped. My son is dying, and you're the only doctor here. So here's what's going to happen. I'm going to help you save my son. I'm going to walk you through every single step, but you need to listen to me carefully and do exactly what I say. Can you do that? The question hung in the air between us. Could I do that? Could I follow instructions from a trapped, injured father to save his own child? Could I set aside my panic and my fear and my sense of inadequacy and just listen and act? I stared at him, at this father facing every parent's worst nightmare, watching his child die while being physically unable to help, and I saw something in his face that cut through my panic. Not hope exactly, not even confidence, but determination. The absolute refusal to let his son die without fighting with every resource available, even if that resource was a terrified rookie who'd frozen at the worst possible moment. "Yes," I whispered, my voice hoarse. "Yes, I can do that. Good. That's good." Something like relief flickered across his face. "Then let's begin. We don't have much time, but we have enough if we're smart about this. First question, do you have a stethoscope?" The question was so simple, so concrete, that it cut through the abstract terror. Yes, I had a stethoscope. I pulled it from around my neck with hands that still shook but at least moved now. "Good. Listen to his chest. Tell me what you hear. Left side first, then right side. Take your time and really listen." I placed the stethoscope on Marcus's chest, struggling to hear anything over the sounds of rescue equipment, radio chatter, my own pounding heartbeat. But there, yes, there, breath sounds. Present on the right, but on the left. "Decreased breath sounds on the left," I reported, my voice steadier now that I had a concrete finding to focus on. "Decreased or absent?" I listened again, concentrating. "Decreased, present but diminished. Good. Likely pneumothorax. Collapsed lung. The broken rib from the impact probably punctured it. We'll deal with that. What's his respiratory rate? Count for 15 seconds and multiply by 4. I watched Marcus's chest rise and fall, counting. 28, maybe 30 breaths per minute. Tachypneic. Respiratory distress. His body knows it's not getting enough oxygen. Dr. Chen's voice remained steady, clinical, like he was teaching a class rather than directing treatment for his dying son from inside a destroyed car. Check his neck veins. Look at the sides of his neck. Are they distended? Bulging out? I looked carefully at Marcus's neck. No, they're flat. Normal. Good, that's good. Not a tension pneumothorax yet. No air trapped and building pressure. We have time. Check his trachea. Put your fingers gently on his windpipe. Is it in the midline or pushed to one side? I carefully palpated Marcus's neck, feeling for the trachea. Midline. Centered. Excellent. So we have a simple pneumothorax, not a tension. That means we can manage it for now and deal with it at the hospital. But we need to monitor it closely because it can convert to tension, and then we'd need to do a needle decompression in the field. Do you know how to do that? I've seen it. In simulation. Good enough. We'll cross that bridge if we come to it. Now, circulation. Can you feel a pulse? Radial artery. At the wrist. I pressed my fingers against Marcus's wrist, searching for the familiar throb of pulse. It took a moment to find. The pulse was there but thready, fast, weak. Yes, but weak, fast, maybe 130, 140 beats per minute. Tachycardic. He's compensating for blood loss and poor oxygenation. His body is trying to deliver what little oxygen it has more rapidly. Blood pressure? I don't have a cuff with me here in the car. Estimate based on pulse character. Can you feel it at the wrist? Strong, weak, barely palpable? Weak. Present at the wrist, but definitely weak. So systolic blood pressure probably around 90, maybe less. That puts him in class 2 hemorrhagic shock, approaching class 3. He's lost significant blood volume. Dr. Chen paused, and for the first time I heard a tremor in his voice, the father breaking through the professional facade. My son is in shock. We need to move faster. The firefighters were still working on cutting open the driver's door, the hydraulic tools screaming and throwing sparks. But the progress was slow, the metal was thick, reinforced, and the angle was wrong. It would be minutes yet before we could extract the patients properly. Minutes we might not have. Dr. Chen, I said, my voice gaining strength now that I had concrete problems to solve rather than abstract fear to manage. We need to get Marcus out of the car to treat him properly. No time! Dr. Chen cut me off. Look at his pupils again. Tell me what you see. I shined my penlight. The left pupil was even more dilated now, a black void consuming the iris. The right remained pinpoint, and as I watched, Marcus's breathing pattern changed, became irregular, with periods of deep breaths followed by shallow ones. Cheney-Stokes breathing, I remembered, a sign of increased intracranial pressure. The left pupil is larger than before, I reported, and his breathing pattern is changing. He's herniating. His brain is swelling, pushing through the foramen magnum at the base of the skull. If we don't act immediately, he'll die. Dr. Chen's voice was tight now, urgent. You're going to have to work in here. It's not ideal, it's not what we do in the hospital, but it's what we have. Can you start IVs while he's in the car? I looked at the cramped space, at Marcus's arms tangled with seatbelt and pinned by position. I think so. It'll be difficult. Difficult is better than dead. You need 2 large-bore IVs, antecubital fossa, the crook of the elbow. Look for a vein. His blood pressure is low, so they'll be hard to find. You're going to need to feel more than see. Marcus, the paramedic, appeared at my shoulder with a medical kit, seeming to understand what was needed. IV supplies, and I'll call ahead to the hospital. What do you want me to tell them? I looked at Dr. Chen, who nodded for me to take the lead. I took a breath and tried to organize my thoughts into coherent clinical presentation. Tell them we have a 17-year-old male, severe closed head trauma with blown left pupil, likely subdural or epidural hematoma with active herniation, left-sided pneumothorax, hemorrhagic shock, class 2 to 3, tachycardic, tachypneic, hypotensive, GCS. I paused, calculating. Marcus hadn't opened his eyes, made no verbal response, and only withdrew from pain. GCS of 5, maybe 6. They need to have the trauma bay ready, neurosurgery on standby, and OR available immediately. Marcus the paramedic nodded, already moving away with his radio. Dr. Chen was watching me with something that might have been approval. Good report. You remembered more than you thought you did. Now the IVs. You've done this before? In simulation. On healthy volunteers with good veins. It's the same principle. Find the vein, clean the site, insert at 15 degrees, watch for flashback, advance the catheter, secure it. Just like practice, except the stakes are real. You can do this. I pulled on gloves with shaking hands and examined Marcus's arms. The veins were flat, collapsed from shock and blood loss. This was going to be nearly impossible. I ran my fingers along the antecubital fossa, feeling for the subtle ridge of a vein beneath the skin. There, maybe, a faint cord-like structure that might be the median cubital vein. I think I feel something here, I said, indicating the spot. Trust your fingers. Visual is helpful, but tactile is better, especially in shock. Clean it and go for it. I cleaned Marcus's skin with an alcohol wipe, my hands still trembling. I positioned the IV catheter, 18 gauge, large bore for rapid fluid resuscitation, and took a breath. The angle looked wrong. The vein felt too small. Every instinct screamed that I was going to fail. But Dr. Chen's voice was calm. You're overthinking. Just push. Smooth, steady motion. You'll feel it when you're in. I pushed. The needle pierced skin. Then I felt resistance. The vessel wall. I pushed through. Suddenly, a flash of dark red blood appeared in the catheter chamber. I was in. I got it! Flash of blood! Good. Now advance the catheter off the needle. Pull the needle out. Connect the IV tubing. Quick but careful. My hands seemed to know what to do, even though my brain was still catching up. I advanced the plastic catheter into the vein, withdrew the needle, connected the tubing, opened the flow. Clear fluid began dripping into Marcus's circulatory system. First IV running wide open, I announced. Perfect. Now the second one. Same process. You're doing great. The second IV was slightly easier. I found a better vein on the other arm, got it on the first try with more confidence this time. Within minutes, Marcus had 2 large bore IVs running normal saline wide open, starting to replace his lost blood volume. 2 IVs in and running, I reported. What's next? Now we need to address the herniation. His brain is swelling inside a rigid skull. Pressure is building. In the hospital, we'd take him to OR, do a craniotomy, evacuate the hematoma, relieve the pressure. But we can't do that here. So we're going to do medical management. Give his brain the best chance until we can get him to definitive care. Do you have mannitol? Hyperosmolar solution? I looked at Marcus, the paramedic, who was already checking the ambulance supplies. He shook his head. No mannitol in the field anymore. But we have hypertonic saline. That'll work. 3% saline, 250 cc bolus. That will temporarily draw fluid out of the brain tissue, reduce intracranial pressure, buy us time. Running it now, Marcus confirmed, hanging the bag and connecting it to one of the IVs. Good. And we need to hyperventilate him. Dr. Reyes, can you bag him? 20 breaths per minute, regular and controlled. Hyperventilation causes vasoconstriction in the brain, reduces blood flow, which reduces swelling. It's temporary, but it might keep him alive. I positioned the bag valve mask over Marcus's face, checking the seal, ensuring it was tight. One hand held the mask, the other squeezed the bag. 1 breath, 2, 3. I counted, trying to maintain the rhythm Dr. Chen had specified. Good. Maintain that. We also need to keep his head elevated if possible, reduces venous pressure, helps drainage. But he's in a C-collar and we can't risk spinal movement, so we work with what we have. The firefighters finally broke through. The driver's door fell away with a screech of tortured metal, and suddenly access improved dramatically. But Marcus was still trapped by the deployed airbag and the positioning of his seat. We can get the backboard in now, one firefighter said. Get him out and into the ambulance. No sudden movements, Dr. Chen ordered, his voice carrying authority even from his trapped position. C-spine precautions absolute. He has a severe head injury. Any jostling could make the herniation worse. Slow and steady. More hands arrived, another paramedic team, additional firefighters. Under Dr. Chen's continued direction, I supervised the extraction. C-collar check, properly sized and positioned. Backboard slide, careful attention to keeping the head, neck, and spine aligned. Straps secured, every movement coordinated. It took 10 minutes that felt like hours. But finally, Marcus Chen was out of the car, on the backboard, being wheeled toward the waiting ambulance. Get him transported now, Dr. Chen called. Dr. Reyes, you go with him. Monitor his pupils every 2 minutes. If they get worse, if he stops responding at all, if his breathing changes, You call it in immediately. The hospital is 12 minutes away. That's 12 minutes my son needs to survive, you understand? Yes, I'll keep him alive. I know you will. Dr. Chen's voice softened almost imperceptibly. Thank you for listening, for trusting me, for not letting your fear win. I wanted to say more. Wanted to thank him for saving me from my own panic, for teaching me how to function in crisis. But there wasn't time. I climbed into the ambulance with Marcus, and we pulled away. Lights and sirens announcing our desperate race against time. Marcus the paramedic drove while I stayed in the back. My whole world narrowed to monitoring vitals, bagging respirations, checking pupils every 2 minutes like my life depended on it. Like Marcus's life depended on it. Because it did. The first pupil check, unchanged. Left still blown, right still constricted. Not better, but not worse either. The second check at 2 minutes, the same, holding steady. But around minute 5, things changed. Marcus's oxygen saturation, which had been hovering around 92%, suddenly dropped. 88%, 85%, 82%. His sats are dropping, I called to Marcus the paramedic. The pneumothorax? I listened to his chest again. The breath sounds on the left were now absent, not just decreased. And his neck veins, which had been flat before, were now distended. His trachea, which I checked quickly, was deviated to the right. It's converted to tension pneumothorax. Air is trapped and building pressure. It's compressing his heart and great vessels. Can you decompress it? Could I? Needle decompression. Inserting a large angiocath between the ribs to release the trapped air. I'd practiced it once on a mannequin in a controlled classroom setting. And now I was supposed to do it for real, in a moving ambulance on a patient who was already critically injured. But I thought about Dr. Chen's words, about not letting fear win, about doing what needed to be done even when you weren't sure you could do it. Yes, I can do it. I found the landmark, second intercostal space, mid-clavicular line, on the left side, the spot where the needle needed to go. I prepped the area quickly with an alcohol wipe, positioned the large bore angiocath at a 90-degree angle to the chest wall. One push and I'd either save him or puncture something vital and kill him. I took a breath, steadied my hand, and pushed. Resistance as the needle went through skin. More resistance through muscle and intercostal tissue. Then a pop, subtle but unmistakable, as I penetrated the pleural space. Immediately, a rush of air escaped through the catheter. A hissing sound that was the most beautiful thing I'd ever heard. The trapped pressure releasing. I advanced the catheter, removed the needle, secured the catheter in place. Within seconds, Marcus's oxygen saturation began climbing. 84%, 86%, 89%, 92%. It worked, I breathed, almost unable to believe it. Of course it worked, Marcus the paramedic called from the front. You knew what to do. You just needed to believe you could do it. The rest of the transport was a blur of continued monitoring, continued bagging, continued checking pupils that remained unchanged. Still bad, but not worse. By the time we pulled up to St. Halstead's ambulance bay at 3:24 a.m., I'd fallen into a rhythm. Assessment, intervention, reassessment, the basic cycle of emergency medicine. The doors flew open, and we were met by the trauma team. Dr. Morrison stood at the center, commanding the organized chaos around her. Report, she ordered, as we wheeled Marcus Chen toward Trauma Bay 1. I gave her everything, my voice steady now despite the exhaustion and adrenaline crash already beginning. 17-year-old male unrestrained passenger in high-speed MVA. Severe closed head trauma with blown left pupil, likely intracranial hemorrhage with active herniation. Left tension pneumothorax, treated with needle decompression in the field. Hemorrhagic shock, currently getting volume resuscitation through 2 large bore IVs. GCS on scene was 5, unchanged during transport. Also received hypertonic saline and hyperventilation for ICP management. Last vitals, BP 88/52, heart rate 138, respiratory rate 32, O2 sat 92% on bag valve mask. Dr. Morrison's eyebrows rose slightly. From her, that was practically a standing ovation. Good report. Neurosurgery is on the way down. Let's get a stat CT and prepare for OR. She glanced at me. You did the needle decompression? Yes, ma'am, in the ambulance when he converted from simple to tension pneumo. And it worked, obviously, since he's still alive. She almost smiled. Well done, Dr. Reyes. Now step back and let the team take over. You've done your part. I moved to the side of the trauma bay, watching the organized chaos as the team worked. IVs were changed to blood products. A chest tube was placed to fully evacuate the pneumothorax. Labs were drawn. Imaging was ordered. The neurosurgery team arrived and began their rapid assessment. I'd done it. I'd frozen. Yes, I'd panicked. I'd felt completely inadequate and overwhelmed, but I'd also listened. I'd followed instructions from a father trapped in a car, coaching me through saving his own son's life. I'd pushed through my fear and done procedures I wasn't sure I could do. And Marcus Chen was alive, for now. That was something. Dr. Reyes, Dr. Morrison appeared beside me. The father is arriving in 2 minutes. He'll need treatment too. Probable rib fractures, definite arm fracture, possible internal injuries. You up for it? Yes, good, because he's been asking for you. Apparently you two worked together. Dr. James Chen arrived shortly after, extracted from his car and transported in the second ambulance. He was wheeled into Trauma Bay 2, still trying to direct his own care even while obviously in significant pain. "My son?" he called out the moment he saw me. "Where's Marcus? Is he alive?" I moved to his side. "He's alive. He's in CT right now. Neurosurgery is evaluating him. He's critical but stable. The herniation? We managed it with hypertonic saline and hyperventilation, just like you said. His pupils stayed unchanged during transport. He converted to tension pneumo about halfway here, so I did a needle decompression." "You did a needle decompression in the field?" For the first time, Dr. Chen looked surprised. "That takes nerve. How'd it go?" "It worked. Immediate improvement in his oxygen saturation." He managed a slight smile despite the obvious pain as nurses began cutting away his clothes to assess his injuries. "You did well, Dr. Reyes. Better than well. You stayed calm when it mattered most." "I froze," I admitted. "At the crash site, I completely froze. I couldn't remember anything. If you hadn't been there, but I was there, and you were smart enough to listen, humble enough to accept help. Do you know how many young doctors would have let pride get in the way? Would have insisted they knew what to do and fumbled through on their own?" He winced as the nurses palpated his chest. "Pride kills patients, Dr. Reyes. Humility saves them. You learned that lesson early. Hold on to it." A nurse approached me. "Dr. Reyes, Dr. Morrison wants you. Marcus Chen is going to the OR. They're taking out a subdural hematoma." I looked at Dr. Chen. "I should go update you after." "Go. Save my son. I'll be here." His voice was firm, controlled, but I could see the fear in his eyes. The father behind the surgeon, terrified and helpless. "Just bring him back to me. I will do everything I can." I left him there and went to observe as Marcus Chen was wheeled to the operating room, where neurosurgeons would drill into his skull and try to save his life. And I realized something. Medicine wasn't just about knowledge and skills. It was about being human in the face of suffering, about asking for help, about trusting others, about doing your best even when your best feels completely inadequate. Dr. James Chen had taught me all of that in 30 minutes of the worst night of his life. Now I had to make sure his son survived, so he'd have the chance to teach others the same lessons. I spent the night in a fugue state, half exhaustion, half adrenaline, existing in that liminal space where time feels both endless and compressed. Marcus Chen was in surgery for 3 hours, while neurosurgeons carefully opened his skull, evacuated the subdural hematoma that had been killing him, and placed a monitor to track intracranial pressure. Meanwhile, Dr. James Chen underwent his own surgery, an open reduction and internal fixation of his compound arm fracture, placement of a chest tube for his pneumothorax, and treatment for 3 broken ribs that had, miraculously, not punctured his lung or other organs. By 8 a.m., both father and son were in the ICU on different floors, both alive, both stable, in the fragile way that trauma patients are stable, balanced on a knife's edge between recovery and deterioration. And I was in the residence lounge, still wearing blood-splattered scrubs that weren't even my patient's blood, but rather the evidence of a night that had changed everything I thought I knew about medicine. Dr. Morrison found me there, staring at nothing, my coffee cold in my hands. "Reyes, you should go home. I want to stay. I want to see how they do. Both of them." "Why? Your shift is over. You did your job. More than your job, actually." "Because..." I searched for words to explain the connection I felt, the responsibility, the need to see this through. "Because I need to know if what I did mattered, if I made a real difference or if I just got lucky." Morrison sat down beside me, which was unusual enough that I looked up in surprise. She never sat with residents. She directed, corrected, and occasionally praised, but she didn't sit and chat. "You want to know the truth?" she asked. "Both. You got incredibly lucky that the father was a trauma surgeon who could guide you through it. But luck only matters if you're smart enough to use it. You made a choice at that crash site. You could have let ego get in the way, could have insisted you knew what you were doing, could have fumbled through alone. Instead, you listened. You trusted. You set aside your pride and your fear and you let someone help you. That's not luck, Reyes. That's wisdom. I froze. I said again, unable to let go of that failure. When I saw how bad Marcus was, I forgot everything. Every bit of training just vanished. Do you know how many residents freeze their first time at a major trauma? Most of them. The good ones snap out of it. The great ones learn from it. She paused, choosing her words carefully. You're going to have moments in medicine where you don't know what to do. Situations that aren't in textbooks, that you haven't practiced, that require improvisation and trust and collaboration. Those are the moments that define what kind of doctor you become. Last night, you showed me what kind of doctor you're going to be. What kind is that? The kind who saves lives not despite their limitations, but because they know their limitations and aren't afraid to work around them. She stood. Go home, sleep, come back tonight if you want. The Chen family will still be here. I drove home as the sun rose, painting the sky in shades of pink and gold that felt obscene in their beauty. How could the world be this beautiful when people were dying, when families were being torn apart, when a 17-year-old was fighting for his life in an ICU bed? My apartment was cold and empty. I peeled off my scrubs, noticing for the first time the cuts on my hands from climbing through the car window, the bruises on my knees from kneeling on glass-covered pavement, physical evidence of a night that felt increasingly surreal. I tried to sleep, but couldn't. My mind kept replaying moments. Marcus's blown pupil, Dr. Chen's steady voice, the feel of the needle going into Marcus's chest, the hiss of escaping air, the flash of blood in the IV catheter. My phone buzzed. A text from my mother. Mijo, how was your shift? We're praying for you. I stared at the message for a long time before responding. Hard, really hard, but I think I helped someone. I'll call you later. Her response came immediately. We're so proud of you. No matter what happens, we're proud. I finally slept around 10 a.m. and woke at 4 p.m. to my alarm. My body ached, my head pounded, but I was driven by a need I couldn't name. I had to know how Marcus was doing, had to see Dr. Chen, had to close the loop on a story that had started with my failure and somehow ended with survival. I returned to St. Halsted at 6 p.m., hours before my scheduled shift. First stop, the neuro ICU where Marcus Chen lay in a medically induced coma, his head wrapped in bandages, a pressure monitor protruding from his skull like something from a science fiction movie. The nurse, a middle-aged woman named Sandra with kind eyes, looked up when I entered. You're Dr. Reyes, the one who brought him in? Yes. How is he? Holding steady. ICP has been elevated but manageable. Neurosurgery is pleased with the operative result. The hematoma was significant. Another 30 minutes and he probably wouldn't have made it. Another 30 minutes. The time it would have taken if Dr. Chen hadn't coached me through field stabilization. If I'd frozen for longer. If we'd waited for someone more experienced. When will they wake him up? Not for a few days. They want to keep him sedated while the swelling goes down, let his brain rest. But his vitals are good. He's young, healthy. He has a fighting chance. I stood at Marcus's bedside, looking at this teenager I'd saved but didn't know. What was he like when he wasn't unconscious and dying? Did he play sports? Have a girlfriend? Dream about college? What were his hopes, his fears, his plans for a future that had nearly been stolen from him? His father has been asking about him, Sandra said. He's on the trauma surgical floor, room 412. He can't come here yet, not stable enough to be moved, but he's desperate for updates. I went to find Dr. James Chen. Room 412 was a private room, courtesy extended to a fellow physician, no doubt. He was sitting up in bed despite obvious discomfort, his left arm in a cast and sling, chest wrapped for his broken ribs, an oxygen cannula in his nose. When he saw me, his face transformed with desperate hope. Dr. Reyes, Marcus, is he alive? No one will tell me anything concrete. They keep saying he's stable, but I'm a doctor. I know what stable can mean. I pulled a chair close to his bed and gave him what he needed. Not platitudes, but facts. He's in the neuro ICU, intubated and sedated. The surgery went well. They removed a subdural hematoma that was about 50 cc's of blood. They placed an ICP monitor. Pressure has been elevated but responding to management. All his vitals are stable. They're keeping him sedated for the next few days to let the brain swelling subside. Dr. Chen closed his eyes, absorbing the information. When he opened them, they were wet, Prognosis? Too early to tell. The neurosurgeons are cautiously optimistic. The fact that we got him to OR quickly, that the hematoma was evacuated successfully, those are good signs. But traumatic brain injury is unpredictable. I know. God help me. I know. His voice cracked. I've given this speech to families 100 times. I just never thought I'd be on the receiving end. We sat in silence for a moment. Then Dr. Chen said, "Can I ask you something? At the crash site, when you first saw Marcus and realized how bad it was, what went through your mind?" I considered lying, offering a sanitized version. But this man had trusted me with his son's life. He deserved honesty. Terror. Complete, overwhelming terror. I looked at him and couldn't remember a single thing I'd learned. My mind went blank. I thought I was going to watch him die because I'd frozen. But you didn't freeze. Not really. I did for those first few seconds. If you hadn't been there, but I was there. And you were smart enough to use me as a resource. He shifted carefully, wincing. Dr. Reyes, do you know why I became a trauma surgeon? No. When I was a medical student, I witnessed a car accident. Nothing as severe as last night, but bad enough. A woman was trapped in her car, conscious but severely injured. I was the only medical personnel at the scene. I had no idea what I was doing. I was a third-year medical student who'd done exactly one trauma rotation. I was terrified. What happened? An off-duty paramedic arrived. He talked me through it, had me start an IV, control bleeding, stabilize her spine. He couldn't do it himself. He'd injured his hand trying to break the window. So he used me as his hands while he provided the knowledge. Together, we kept her alive until the ambulance arrived. So, you were paying it forward last night? Exactly. That experience changed my entire career trajectory. I realized that trauma medicine isn't about individual heroics. It's about teamwork, communication, and the ability to function in chaos. Those 30 minutes with that paramedic taught me more about medicine than a whole semester of lectures. And now you've done the same for me. Yes? But here's what I need you to understand. What we did last night worked because neither of us let pride get in the way. I had to admit I was helpless, that I needed to work through someone else. You had to admit you were overwhelmed, that you needed guidance. Neither of us tried to be the hero. We just focused on saving Marcus. I thought about that, about how modern medicine glorifies the brilliant individual doctor, the house-like figure who solves impossible cases alone. But the reality was so different. The reality was messy, collaborative, dependent on dozens of people working together. I learned more from you in 30 minutes than in 6 months of residency, I said. Then promise me something. Promise me you'll teach what you learned. Pass it forward. Make sure the next generation understands that asking for help isn't weakness, it's wisdom. I promise. Dr. Chen leaned back against his pillows, exhausted from the conversation. Thank you for coming to see me, and thank you for saving my son. I know we're not out of the woods yet, but you gave him a chance. That's all any parent can ask for. I left him to rest and returned to the ER for my scheduled shift. Dr. Morrison was there, reviewing charts. She looked up when I entered. Couldn't stay away? I needed to see them, both of them. And? They're alive. That's enough for now. She nodded. Get to work, Reyes. We've got patience. The shift was busy but manageable. Nothing that compared to the drama of the previous night. I treated a woman with a kidney stone, a man with a laceration requiring stitches, a child with croup. Normal ER fare, the kind of medicine that felt almost mundane after what I'd experienced. But I noticed something different in how I approached each case. I was more careful, more thorough. I asked more questions of patients, of nurses, of other doctors. I wasn't afraid to say I'm not sure, or can you help me think through this? Dr. Chen had taught me that medicine was a team sport. Now I was playing it that way. Over the next week, I checked on the Chen family daily. Doctor. James Chen was discharged after 5 days, his injuries healing well but requiring extensive physical therapy. Before he left, he asked me to continue following Marcus's case. I trust you, he said simply. You were there at his worst moment. I want you to be part of his recovery too. Marcus remained in the ICU for 10 days. On day 3 post-surgery, they began weaning his sedation. On day 5, he started showing purposeful movements. On day 7, he opened his eyes for the first time. I was there when it happened. Dr. Chen had been transported back to the hospital in a wheelchair, against medical advice but with the resigned acceptance of staff who understood that you couldn't keep a father away from his son. We sat on opposite sides of Marcus's bed, watching monitors like they held the secrets of the universe. The neurologist had decreased the sedation that morning. Now we waited to see if Marcus would wake up, or if the brain injury had been too severe. At 2:37 p.m., Marcus's eyes fluttered, then opened. Confused eyes, frightened eyes, but open eyes, conscious eyes. "Dad?" His voice was hoarse from the breathing tube that had been removed 2 days earlier, barely audible. What happened?" Dr. Chen's face crumpled. He sobbed, a raw, unguarded sound I'll never forget. "You're okay. Oh God, you're going to be okay. My head hurts. Where are we?" "Hospital. We were in an accident. But you're safe. You're alive." Marcus's gaze drifted around the room, trying to make sense of his surroundings. When his eyes landed on me, they showed no recognition. "Who's that?" "That's Dr. Reyes. He saved your life." "I don't remember." "You don't need to remember. Just know that you're here, you're safe, and everything's going to be okay." I stood in the doorway, not wanting to intrude on their moment. This was between father and son, between a man who'd faced his worst nightmare and come out the other side. But Dr. Chen caught my eye and mouthed 2 words, "Thank you." I nodded, unable to speak past the emotion closing my throat. Marcus Chen's recovery was not a straight line. Over the following weeks, the extent of his brain injury became clear. He had significant short-term memory problems, forgetting conversations within minutes of having them. His right side was weak, requiring extensive physical therapy. He struggled with concentration, with processing information, with tasks that had once been effortless. The neurology team explained it would take months, possibly years, of rehabilitation. He might never fully recover all his functions. Brain injuries were unpredictable, they said. Every case was different, but he was alive. He was conscious. He could speak, could think, could recognize his father. Given how close he'd come to death, it was miraculous. Dr. James Chen was discharged after a week, but came to the hospital daily to be with his son. His own injuries were healing. The arm fracture would take months to fully heal, and he'd need physical therapy to regain full function, but his prognosis was good. I continued my regular rotations in the ER, but I visited Marcus whenever I had free time. Dr. Morrison noticed and pulled me aside one afternoon. "Reyes, you're getting too attached to this patient. He's not just a patient. He's someone whose life you saved in dramatic circumstances, I understand. But you need to maintain boundaries. You can't follow every patient forever, no matter how connected you feel to their case. His father asked me to watch over him," Morrison sighed. "And I respect that. But remember, you have other patients, other responsibilities. Don't let one case, no matter how significant, consume you. That's how doctors burn out." She was right, I knew. But I couldn't help it. The Chen case had changed something fundamental in how I viewed medicine. I'd faced my worst fear, being inadequate in a crisis, and survived it. I'd learned that asking for help wasn't weakness but wisdom. I'd seen what medicine could be when ego took a backseat to patient care. 2 weeks post-accident, Dr. Chen asked to meet with me. Not in the hospital, but at a coffee shop near campus. He was out of his cast now, his arm in a sling, moving carefully because of still healing ribs but looking more like himself. "Thank you for coming," he said as I sat down with my coffee. "How's Marcus doing?" "Making progress. Slow, frustrating progress, but progress. He walked 15 steps with a walker yesterday, remembered what he ate for breakfast. Small victories." He wrapped his hands around his cup. "I wanted to talk to you about something, about that night." "Okay, I need to be completely honest with you. When I first saw you at the crash site, so young, so obviously scared, so inexperienced, I was angry, furious actually. I thought, they sent me a child to save my son. We're going to die because this rookie doesn't know what he's doing. The words hurt, even though I'd suspected as much. I wouldn't blame you for thinking that. But then I saw your face. I saw the fear, yes, but I also saw the willingness to try. And I realized something. If I pushed you away, if I insisted on waiting for someone more experienced, we'd lose time. Time Marcus didn't have. So I made a choice. I could be angry about what I didn't have, or I could work with what I did have. I'm glad you chose to work with me. So am I. But here's what you need to understand. What we did that night worked because we both made ourselves vulnerable. I had to admit I was helpless, that I needed to work through you. You had to admit you were overwhelmed, that you needed my guidance. Neither of us let pride get in the way. You taught me more in 30 minutes than I learned in months of training. And you taught me something too. You taught me what it's like to be on the other side, to be the family member trusting a doctor, rather than being the doctor everyone trusts. It was humbling, terrifying, illuminating. He leaned forward. "Dr. Reyes, I want to offer you something. I want to mentor you through your residency. I stared at him, not quite believing what I was hearing. What? I'm a trauma surgeon. You're an ER resident who'll rotate through trauma. Let me teach you, not just technical skills, but the approach, the mindset, how to stay calm in chaos, how to make decisions with incomplete information, how to balance confidence with humility, how to ask for help without shame. I don't know what to say. Say yes. I think we make a good team. And I want to ensure that what happened that night, the collaboration, the trust, the willingness to teach and learn, becomes a model for how you practice medicine going forward. Yes, I said immediately, without hesitation. Absolutely, yes. He smiled, a genuine smile that reached his eyes for the first time since the accident. Good, then let's start next week. I'm cleared to return to work part-time. Come to my hospital, Metropolitan, and shadow me in the trauma bay. See how I work. Ask questions, learn, make mistakes in a controlled environment. Become the kind of doctor you showed me you could be. Over the next months, my life took on a new rhythm. At St. Halstead, I completed my required ER rotations, treating the steady stream of emergencies that came through our doors. At Metropolitan Hospital, I learned trauma surgery from Dr. James Chen. He was an exceptional teacher, patient, thorough, willing to explain not just what to do, but why. He let me assist in surgeries, coached me through procedures, gave me increasing responsibility as my skills improved. He pushed me hard, but never beyond what I could handle. But more than technical skills, he taught me the art of medicine, how to talk to terrified families without offering false hope or crushing their spirits, how to make life or death decisions in seconds when you didn't have complete information, how to carry the weight of bad outcomes without letting them destroy you, how to celebrate good outcomes without becoming overconfident. Medicine is about two things, he told me one day while we were scrubbing for a trauma surgery. A teenage girl, car accident, ruptured spleen, knowledge and character. Knowledge you can learn from books and practice. Character that you learn from crisis. That night on the highway taught you about character. Don't forget those lessons. What lessons specifically? That freezing under pressure is normal. It's your body's natural response to overwhelming stimuli. That asking for help is strength, not weakness. That ego kills patients, but humility saves them. That being a doctor means being human, vulnerable, fallible, but committed to doing your best anyway. He held up his scrubbed hands for the nurse to glove. Those lessons will serve you better than any technical skill I can teach you. Meanwhile, Marcus continued his slow recovery. By 3 months post-accident, he was walking without assistance, though he still had a slight limp. His memory had improved dramatically. He could hold conversations, remember events, function day to day. The right side weakness was resolving with physical therapy, though he'd probably always have some deficit. The neurology team was cautiously optimistic about his long-term prognosis. He'd never be exactly who he was before the accident. Traumatic brain injury changes people in subtle and not-so-subtle ways. But he'd recover enough function to live independently, to finish high school, maybe even to go to college. I visited him regularly at the rehab facility where he was doing intensive therapy. We'd become friends in a way that transcended the normal doctor-patient relationship. He didn't remember the accident or the immediate aftermath. His memory of that week was completely gone, but he knew the story. His father had told him everything. It's weird, Marcus said during one visit while we sat in the facility's common room. Outside the window, autumn leaves were falling. 3 months had passed since that terrible night. Knowing I almost died but not remembering it. It's like it happened to someone else. How do you feel about it? Grateful, mostly. Grateful I'm alive. Grateful my dad survived too. Grateful for people like you who didn't give up on me. He paused, struggling to find words. The brain injury made complex thoughts harder to articulate. But also, scared sometimes. What if it happens again? What if I never get back to normal? What if I can't do all the things I planned? What did you plan? I wanted to study engineering, build things, maybe work in robotics or aerospace. Now I don't know if I can handle the math and physics. My brain doesn't work the same way anymore. Maybe it doesn't. But that doesn't mean you can't do meaningful things with your life. Just maybe different things than you originally planned. That's what my dad says. He says the best doctors are the ones who've suffered, who know what it's like to be vulnerable. He thinks I should consider medicine. What do you think? Marcus looked out the window at the falling leaves. I think I'd like to help people the way you and my dad helped me. I think I'd like to be part of saving lives instead of building machines. He turned back to me. My dad talks about you all the time, you know. About how you stayed calm, how you listened to him, how you did everything right. I didn't do everything right. I froze. I panicked. I felt completely out of my depth. But you didn't let that stop you. That's what he always emphasizes, that you were humble enough to accept help, smart enough to listen. He says that's rare in young doctors. Most of them are too proud. I thought about that. About how medical training often encouraged the opposite, encouraged confidence bordering on arrogance, encouraged the appearance of always knowing what to do, encouraged hiding uncertainty behind professional masks. Can I tell you something? Marcus said. Something I haven't told my dad because I don't want him to feel guilty? Of course, sometimes I'm angry. Angry that this happened to me. Angry that my brain doesn't work right anymore. Angry that I lost months of my life and might never get back to normal. And I know that's not fair. It's not my dad's fault some drunk driver hit us, but I still feel it. That's completely normal. Trauma affects us emotionally as much as physically. Have you talked to a therapist about it? Yeah. She says it's part of the process. Grief for the person I was before. He smiled slightly. I'm working through it. Most days are okay. Some days are hard, but I'm alive, and that counts for something. We sat together for a while longer, two people connected by an event that had changed both our lives. When I left, Marcus called after me. Hey, Dr. Reyes, thank you for that night, for not giving up even when you were scared. You're welcome, but your dad deserves most of the credit. I was just the hands. No, you were more than that. You were willing to learn. That mattered. 6 months after the accident, I was completing my trauma surgery rotation at Metropolitan Hospital under Dr. Chen's supervision. I'd grown enormously as a physician, more confident, more skilled, more capable of handling high-pressure situations without freezing. But I was about to face my hardest test yet. It was a Tuesday evening, the early shift just beginning to settle into its rhythm. The trauma bay was relatively quiet, a few non-critical cases being managed, nothing that required the full team's attention. Dr. Chen and I were reviewing upcoming surgical cases when the call came through. Attention all units. Major MVA on Interstate 15, multiple casualties reported. Mass casualty protocol activated. All available trauma teams respond. The familiar tightening in my chest, the spike of adrenaline. But this time, no panic. This time, I knew what to do. Dr. Chen and I moved as a unit, preparing the trauma bay for incoming patients. We'd worked together so long now that we anticipated each other's movements, communicated in shorthand, functioned as a seamless team. The first ambulance brought a woman with severe abdominal trauma, ruptured liver, internal bleeding, hemodynamically unstable. Dr. Chen took her to OR immediately, trusting me to handle the next arrivals. The second ambulance brought 2 patients on a single gurney. Space had been limited at the scene. A father and his young daughter, both injured in the accident. The father was conscious but in severe pain, his right femur obviously fractured, the leg at an unnatural angle. Please, he begged as we wheeled them in. Please help my daughter. I don't care about me. Save Emily. The daughter, maybe 8 years old with blonde hair and a face covered in blood, was unconscious, not moving, not responding. It hit me immediately, viscerally. This was the Chen accident again. A parent and child. The child more critical. The parent desperate and helpless. For a moment, just a moment, I felt the old panic trying to resurface. The fear that I wouldn't know what to do, that I'd freeze again, that I'd fail. But then I remembered. I remembered Dr. Chen's voice in the darkness. I remembered the lessons learned in crisis. I remembered that I wasn't that scared rookie anymore. I'd been here before, and this time, I knew what to do. Sir, what's your name? I asked the father, while simultaneously ordering imaging and calling for neurosurgery. David Morrison. That's my daughter Emily. Is she going to die? I looked at Emily, at her blown pupil, her irregular breathing, all the signs of severe brain injury that I now recognized instantly. The same injury Marcus had had, the same crisis Dr. Chen had coached me through. David, I need you to stay calm and trust me. We're going to take excellent care of Emily. My name is Dr. Reyes, and I know exactly what to do because I've been in this exact situation before. Do you trust me? He looked at me with desperate, terrified eyes. Will she survive? I thought about the promises I couldn't make, the uncertainties inherent in medicine. But I also thought about Marcus Chen, who'd been given the same injury and the same odds and had survived. I'm going to fight for her with everything I have, but right now, I need you to let me work. Can you do that? He nodded, and I turned my full attention to Emily. The trauma team moved around me with practiced efficiency. I'd worked with them enough now to know their rhythm, to trust their competence, to lead without micromanaging. Large bore IVs, bilateral, get a stat CT of her head, call neurosurgery, tell them possible epidural hematoma, blown right pupil, GCS of 5, start hypertonic saline, prepare for intubation, and someone update Dr. Chen, tell him I need him back here as soon as he's out of surgery. The team moved. Within minutes, Emily had IV access, was intubated, had imaging ordered. I performed every procedure with hands that were steady, mind that was clear, confidence that came from having done this before. Dr. Chen appeared while I was inserting a central line, still in his surgical gown from the previous case, having left his other patient in the capable hands of his surgical team. Status? He asked, coming to stand beside me. 8-year-old female, severe head trauma, blown right pupil suggesting epidural hematoma. I've stabilized her for CT. Neuro is on the way. Father has a femur fracture, but that's secondary priority. He looked at Emily, then at me. In his eyes, I saw recognition. He knew we were reliving our own trauma. But I also saw pride. You've got this completely under control. You don't need me here. I know, but I wanted you to see that I could do it. That what you taught me that night, it stuck. I can see that. He put a hand on my shoulder briefly. I'll scrub in with neurosurgery. You coordinate here and take care of the father. Show him the same compassion you showed me. The CT confirmed epidural hematoma, arterial bleeding between the skull and brain, the same injury Marcus had had, but in a slightly different location. Emily needed emergency surgery immediately to evacuate the blood and relieve the pressure. While the neurosurgery team prepped Emily for the OR, I stayed with David Morrison. His femur fracture was painful, but not immediately life-threatening. It could wait while we saved his daughter's life. What he needed now was information, reassurance, someone to be present with his worst moment. Your daughter has bleeding in her brain, I explained, pulling a chair close to his gurney. The neurosurgeons are going to operate right now to remove the blood and relieve the pressure. It's a serious injury, but we caught it early, and she's in excellent hands. She live? Please tell me the truth. I thought about how Dr. Chen must have felt, trapped and unable to help his son. I thought about the terror of being a parent in that situation. She has a good chance. The surgery is one our team has done many times, and children's brains are remarkably resilient. They heal in ways adult brains don't. I paused. I know this is terrifying, but I promise you that everyone in this hospital is fighting for Emily right now. She has the best surgeons, the best nurses, the best technology, and she has you, which matters more than you know. Can I see her before surgery? Absolutely, let me arrange it. I coordinated with the OR team to give David a few minutes with Emily before they took her to surgery. We wheeled him to the pre-op area despite his own injury because some things matter more than protocols. Emily was unconscious, intubated, surrounded by equipment and monitors. David broke down at the sight of her. This small girl who should have been playing with friends, going to school, living a normal childhood, now fighting for her life. Baby girl, Daddy's here. You're going to be okay. You're so strong, so brave. I love you so much. Dr. Chen appeared in surgical scrubs, ready to assist with the operation. He approached David, and I saw something pass between them, the recognition of shared experience, of knowing what it meant to be a parent in crisis. Mr. Morrison, I'm Dr. Chen. I'm going to assist with your daughter's surgery. 6 months ago, my own son had the same injury Emily has. Dr. Reyes here saved his life. Now we're going to do the same for Emily. David looked between us. At Dr. Chen, who'd been where he was. At me, who'd been trusted with both their children's lives. You understand what I'm feeling. Completely. And I promise you, we will fight for Emily with everything we have. The surgery took 3 hours. I stayed with David the entire time, updating him regularly through the OR nurses' reports. We got his femur fracture stabilized, not fully repaired yet, that would require surgery later, but stabilized enough that he was comfortable. Mostly I just sat with him, let him talk about Emily, how she loved gymnastics, how she hated broccoli, how she just lost her first tooth and was excited about the tooth fairy. Normal father-daughter stuff that took on profound meaning when you realized it might be all he had left of her. When Dr. Chen finally emerged, still in his surgical scrubs, his face was tired but satisfied. The surgery went well. We evacuated the hematoma, controlled the bleeding, placed a pressure monitor. Emily's intracranial pressure is normalized. She's being moved to the pediatric ICU. Will she wake up? David asked, his voice breaking. In time, yes. She'll need several days of sedation while the swelling goes down, but we're optimistic about her prognosis. She's young, she's healthy, she got to us quickly. Those are all factors in her favor. David sobbed with relief, and I stayed with him while he processed the news. Stayed with him until he was stable enough to have his own surgery for the femur fracture. Stayed because I remembered what it felt like to be alone in crisis, and I didn't want anyone to feel that way. After David was taken to OR for his own procedure, Dr. Chen found me in the hallway. "You did exceptional work tonight, Dr. Reyes. I just did what you taught me, what we did together 6 months ago." "No, you did what you learned. There's a difference. Teaching provides the knowledge. Learning transforms it into skill. And you've learned. You've become the kind of doctor who can handle anything." He paused. "I was terrified tonight when I heard about Emily. Terrified you'd freeze, that the similarity to Marcus's case would overwhelm you. I was scared," I admitted. "For a moment at the beginning, I felt the panic trying to come back. But then I remembered, I've been here before. I know what to do. And more importantly, I know it's okay to ask for help if I need it. That's the real lesson. Not that you'll never be scared again, but that you've learned to function despite the fear." Emily Morrison woke up 3 days later, just as Marcus had. Like Marcus, she had some deficits, memory issues, coordination problems, weakness on one side, but she was alive, conscious, and expected to make a good recovery with therapy. David Morrison sought me out before he was discharged from his own hospitalization. "Dr. Reyes, I need to thank you, not just for Emily's medical care, but for being there, for staying with me, for making me feel like someone was fighting for my daughter as hard as I would have if I could have. That's what we do. That's what medicine should be. I want you to know I called my brother who's a doctor in Chicago, told him about you, about how you handled everything." He smiled slightly. He said I was lucky to have you. After he left, Dr. Chen pulled me aside. "You know what you just did? You paid it forward. You gave David Morrison what I tried to give Marcus, hope and competence in the face of crisis. I learned from the best, and now you're becoming the best. That's how it works. We learn from those who came before, we add our own experience, and we pass it forward to those who come after." Over the next year, I completed my residency. Emily Morrison made a full recovery. Better than Marcus's, actually, though that might have been due to the specifics of her injury or just luck. David Morrison became a friend, bringing Emily by for follow-up visits even when they weren't strictly necessary, wanting her to know the doctor who'd saved her life. Marcus Chen, now 18, had recovered enough to start college, delayed by a year, but recovered. He decided to pursue pre-med, inspired by his own experience and his father's career. He wanted to be like us, he said, wanted to help people the way we'd helped him. Dr. James Chen continued mentoring me, but our relationship had evolved. We weren't teacher and student anymore. We were colleagues, partners, friends bound by an experience that had transformed both our lives and our approaches to medicine. 5 years after the crash on County Road 58, I was an attending physician at Metropolitan Hospital, working on Dr. Chen's trauma team. Marcus Chen was in his 3rd year of medical school doing rotations at our hospital. The circle was completing itself. One evening, Marcus was shadowing me in the trauma bay when a familiar call came through. Motor vehicle accident, father and teenage son both critical, both injured, ETA 3 minutes. Marcus tensed. I saw the fear flash across his face, understandable given his history. "You okay?" I asked. "Yeah, just memories, or what passes for memories since I don't actually remember it." The patients arrived. The father had severe chest trauma, probable flail chest, possible cardiac contusion. The son had head injuries, not as severe as Marcus's had been, but serious enough to require immediate neurosurgical consultation. I directed the trauma team with the confidence of experience. The father went to OR with Dr. Chen supervising. The son came under my care, and Marcus stood beside me watching. The son's injury was manageable, subdural hematoma, but small, not requiring immediate surgical evacuation. We could monitor it, manage it conservatively. I got him stabilized, arranged for ICU admission, coordinated with neurosurgery. Marcus watched it all with something like awe. When the patient was stable and heading to the ICU, he turned to me. "You made that look easy." It's not easy. It's practiced. Every trauma is different, but the principles stay the same. Stay calm, systematize your approach, prioritize effectively, communicate clearly, and never be afraid to ask for help. Did you ever freeze again? After our accident, I thought about Emily Morrison, about the dozens of other trauma cases I'd handled since. Not like that first time with you, but I still feel fear sometimes. I still have moments of doubt. The difference is, I've learned that fear doesn't have to paralyze you. It can focus you if you let it. My dad says you saved my life. Your dad saved your life through me. I was just the hands. He was the brain. But you were willing to listen. That's what he always emphasizes, that the reason you succeeded was because you were humble enough to accept help, because you didn't let pride get in the way. We walked to the ICU together to check on the teenage son. His father was out of surgery, stable, recovering. The boy was showing good signs, reactive pupils, purposeful movements. He'd probably be okay. Marcus stood at the bedside, looking at this patient who reminded him of himself 5 years earlier. Do you ever think about that night? Our accident? All the time. It changed my entire approach to medicine. How? It taught me that medicine is fundamentally collaborative, that no doctor, no matter how skilled or experienced, knows everything or can do everything alone, that the willingness to ask for help, to trust others, to be vulnerable, those aren't weaknesses. They're what make great doctors. Is that why you and my dad work so well together? Part of it, but also because we trust each other completely. I know he'll support me if I'm wrong. He knows I'll do the same for him. That trust, built on that terrible night when we had no choice but to work together, it became the foundation of everything we do. Marcus was quiet for a moment, processing. Then he said, I want to be a trauma surgeon, like you and my dad. It's a hard road. High stress, long hours, difficult cases. I know, but I also know it's where I belong. I want to help people the way you helped me. I want to be the person who stays calm when everyone else is panicking. I want to teach the next generation what you taught me. Then learn this lesson early and never forget it. The rookie who freezes isn't a failure. The rookie who can't accept help, who lets pride override patient care, that's failure. Freezing is normal. It's what you do after that defines you. Later that night, after our shifts ended, Dr. Chen invited Marcus and me to dinner. We sat in a small restaurant near the hospital, the three of us bound by an experience that had transformed all our lives. 5 years, Dr. Chen said, raising his glass. 5 years since the worst night of our lives became the most important night. 5 years since a rookie froze at a crash site until I said, I'll help you save my son. Just listen. To growth, to healing, and to the partnership that made it possible. We drank, and I felt the weight and the gift of what we'd created together. Not just a surgical team, but a philosophy of medicine. A way of practicing that emphasized collaboration over individual heroics, humility over ego, humanity over technical perfection. The story of that night had become more than our personal experience. It had become a teaching tool, shared with residents and medical students as an example of what medicine should be. The story of the rookie who froze, the father who coached him, and the patient who survived because neither let pride get in the way of care. You know what I realized recently? Marcus said, swirling his drink. I don't remember that night, but it still shaped who I am. The injury changed my brain physically. The experience changed all of us emotionally. We're all different people because of what happened. Are you okay with that? Dr. Chen asked his son, vulnerability showing in the question. Yeah, Dad, I'm okay with it. Because look where we are. You teaching the next generation of trauma surgeons. Dr. Reyes becoming one of the best in his field. Me following in both your footsteps. Something good came from something terrible. That matters. As I sat there with the Chen family, because that's what they'd become to me, family, I thought about the arc of that night 5 years ago. How it had started with my failure, my fear, my complete inadequacy. How it had been transformed by a father's love and determination. How it had ended with survival and the beginning of something larger than any of us. What you taught me that night, I said to Dr. Chen, about asking for help, about collaboration, about being human in crisis. I've been teaching that to every resident I work with, making sure they understand that freezing doesn't make them failures. That pride kills, but humility saves. That's the legacy, Dr. Chen said. Not just that we saved Marcus that night, but that the lessons learned continue, that we're creating a generation of doctors who understand that medicine is a team sport. And that sometimes, Marcus added with a smile, the most important thing a doctor can say is, I need help. We finished dinner and walked out into the cool evening air. The hospital loomed nearby, lit up against the darkness, full of patients and families facing their own crises. Tomorrow, we'd be back there, treating trauma, teaching residents, continuing the work.